All right, I'm going to go over the nuclear medicine images here for the PowerPoint. We don't have too many, so should go pretty quick. But this first one here is a bone scan. So it shows tracers that collect in the kidneys and bladder. So you can see here in each kidney and the bladder, it's filled with the tracers. That's because the kidneys and bladder work as a filtering system for our body. So when you see them in the kidneys and bladder, it's usually normal like that. But then there's other areas, like here in the shoulders, in the spine, in the pelvic area, in the ribs. These are the hot spots for cancer. And remember I said that some hot spots are usually bright white? Well, these ones don't look like that because the image itself is white. You'll see some later where the images are darker and the hot spots are white. But like I said, this is a bone scan. Sometimes it's the full body, sometimes, they won't get the legs. Just depends on what they're looking at. This is another type of bone scan. The patient has a swollen leg, and the scans show a DVT, which is a deep vein thrombosis, which is other words known as a blood clot, in the left lower leg. So again, here you've got the normal bladder filled with the radio tracers. But right here you can see in this left lower leg, on both sides, you can see that there's a blood clot there. This one is a bone scan, so this is what I was talking about where the hot spots look white. So the image itself is darker and then the hot spots are white. So there's a large hot spot in the abdomen on this patient. This is an 8-year-old boy that has an abdominal mass that could be felt. So a palpable abdominal mass means that when they could actually feel it externally. It's actually neuroblastoma, which is a cancer that's often found in the top of the kidney, somewhere around the adrenal glands. It usually happens in younger children. Actually, 4 to 6 is very common age to find it. And this next slide here is actually the same patient when they had a CT scan. So you can see here, all of this area here is that neuroblastoma on the kidney. So it's taking up a large portion of the abdomen. I mean, obviously, as big as it is, it's no wonder they could feel it. This is 2 images. So here on the right, well, I'm sorry, I'm backwards because I'm always talking about anatomical position. Here on the left side of this screen is the bone scan, and then we have an MRI of the same patient. So this is a 16-year-old female patient that has osteosarcoma, which is bone cancer, in her right femur. So you can see it here where all of those radiopharmaceuticals kind of collected in this area. And then again, you can see it here on the MRI. Look at the difference between the bone in her healthy left femur versus her right. You can see all of the osteosarcoma all throughout there. This patient is an 11-year-old boy that had knee pain for 1 month, and the x-rays were fine. And then when they went in for this bone scan, they could see that the patient had osteosarcoma here in their right leg. So I didn't explain this earlier, but this is an anterior projection if you haven't figured that out. So you can see the face, you can see how the ribs are open, feet are pointing forward. Then this is a posterior view, so it's the back side. So you can see the back of the skull, the spine a little bit better. So they always do at least those 2 views. Depends on what they're looking at. They'll do more. This patient actually dropped a steel drawer on her foot 3 months before this nuclear medicine scan. The patient did have regular x-rays after the injury, and they came back negative, which means they didn't find anything. So as you can see here, right in these little hot spots here, the white spots throughout the foot, you can see in different angles, they have, an old injury there. It could have been a fracture that, healed or didn't heal properly. This patient is a 71-year-old male patient that had had radiation treatments 11 years ago, well, 11 years prior to this image, due to lymphoma. And then the patient unfortunately developed osteosarcoma from the radiation in their lumbar spine. So you can see some of the tracers in the kidneys, normal, bladder, normal, right, because that's filtering out. But right here, there's this large, bright, hot spot right in the lumbar spine. That's the osteosarcoma. This patient here is a 17-year-old female. She has maxillary osteosarcoma. There's also some hot spots in her neck. They're not that easy to see on these views, but you can see one right here, and you can see a couple throughout here. So the patient had a CT scan, and it was calcified lymph nodes. So this patient is actually positive for metastatic cancer. And metastatic cancer means the second cancer or malignant growth at a distance from the primary source. So metastatic means when they have cancer in one area and it spreads to another. This patient is actually 32 weeks pregnant. She had a bone scan. So she was diagnosed with breast cancer at 31 years old, and they wanted to rule out Mets. So they wanted to see if the cancer had metastasized anywhere else. So this bone scan was actually negative, and they did not find any Mets. And unfortunately, this patient was not so lucky. This was a bone scan with a patient who has Mets. So you can see the hot spots in the right femur here. You can see them. You can see them in the elbow, the pelvis area, the spine, the shoulders, and then there's 2 spots in the brain. You can see it a lot better on the posterior views. The orbits kind of hide it on the anterior view. You can kind of see them, but that's why we do the different views. But unfortunately, this patient has cancer throughout their body. Same with this one. This patient started out with prostate cancer, and they did the bone scan to rule out Mets, and I mean, it's just awful. It's attacked his entire body. I mean, it's all over in his brain. There's 1, 2, 3, 4, 5, 6 spots, all throughout almost the entire spine, especially when you get to the lower one. It's attacked his entire pelvis, hips, all the ribs, shoulders, in the abdomen. I mean, this patient is probably not even walking. You can tell this patient has a catheter. You can see as the radiopharmaceuticals are actually draining out the catheter between their legs. So this patient's probably in pretty poor condition. This is a thyroid scan. Again, it's such a low resolution image, but we don't need high resolution because all we need to do is be able to see those hot spots. So here's the thyroid here and here on each side, and you can see they've got a large nodule right here on the thyroid on the right side. This is another type of thyroid scan. So it's color scanned, and usually like red spots would indicate an abnormal growth. So there's varying scales in here, but this is a fairly normal thyroid. This is actually a PET with MRI fusion. So PET scan can actually be fused with MRI. It's just what it sounds like. It's a 2-in-1 test that kind of combines the images from your PET scan and an MRI scan. So it actually takes the strengths from both of the different modalities and puts them together. So it gives us another option, a better option to be able to view anatomy. This is the same thing but with CT fusion. So this first image here on your left is a CT scan, and then you've got your PET scan here. So the CT scan shows the anatomy. The PET scan is going to show your hot spots or where there might be abnormalities. And then when you put them together, you've got a wonderful image that can show you not only the hot spots, but exactly where the area is. So that PET scan finds the hot spots that represent abnormal growths, and then a CT scan locates where those spots are in the body. So it really helps to kind of give a better idea of, what's going on and where exactly it's going on in the body. This is another fusion imaging with CT and nuclear medicine. So this is that white blood cell scan that I had talked about before, where they take that special radioactive material and tag it to your white blood cells and then re-inject it into your body, and then it's going to attach to the sites of inflammation. So here you've got your CT image with all the different anatomy, but you can't see what's going on. On your nuclear medicine scan, you can see the areas of white blood cells where it's attached to sites of inflammation in the body. But then when you put the two together, see all the hot spots here? You can see them nice and clear on the fusion image, and you can see exactly where they lie. You know, oh, these two are right in front of the liver, right below it. I mean, it's going to give them much better detail so that they can help get a plan to treat the patient. So this, again, this next one here is just a bone scan with a large mass in the face here, and another one here on the right cheek. So this is kind of a PET scale color chart. So it'll show the different colors and what they mean. So the black to deep purple has little or no activity, blue is low activity, green is medium, yellow and orange and red get to be very high activity. So you can see some of the differences when you look at some of the scans. So this is a PET scan of the brain. So this one is normal. There is some levels of no activity in there where the spinal fluid is and things like that. But this is a patient who has mild cognitive impairment, so like a speech disorder or a loss of memory. Look at how much bigger that area of black and blue where there's low to no activity is. And then a patient with Alzheimer's disease, which might have memory loss or speech impairments. I mean, this is a huge area of low to no activity. So that's really what an amazing thing about the PET scans are, to be able to visually see the function, the activity in the brain, and what's going on, so we can see if there's a reason for the patient's speech impairments or memory loss. This again just kind of gives you a good example of the fusion imaging. So on CT alone, we can see there's a nodule here, there's a mass, we don't know what it is it cancer? But on PET CT together, it's really going to highlight that area, and it's going to show you if the patient actually has cancer or not. This next scan is a lung scan, or a VQ scan. VQ is a ventilation perfusion scan. So it examines the airflow and the blood flow to the lungs. We use it a lot to look for blood clots. So there's multiple views taken. So there's the anterior and posterior view, and then they have the patient lay on their sides and do a right anterior oblique, a left anterior oblique, a left posterior oblique, and a right posterior oblique. That way we're getting a lot of different views of the lungs, so nothing's hiding. This is another one. So this is normal lungs. It has the normal shape of the lungs here. And then on this side, it's abnormal. So you can see areas. See how this is blacked out, where there's no blood flow, and the lungs are kind of cut short down here. So these would be cold spots or abnormal spots on a VQ scan. It could be possibility of blood clots right there, which is not allowing the blood to flow normally. This is a PET scan with CT or MRI. So this one can show the cell activities. So the white area, like right here, so you've got this mass right here, right, in the left lung. And then this white area here is hypermetabolic. So that means that the cancer is growing in that area. Usually that's going to appear white or yellow, and it's going to be a hot spot. So that's showing that something's still growing. Some cancer cells are already dying or dead from either lack of oxygen or no blood supply. And those are darker. We call those, the cold spots. So this is the dead cell portion of it. So it gives you two nice views of that growth, and you can see where it's still growing and where it's dead. So this is nice for physicians to be able to go in and really get a plan of what's going on, and is this tumor still growing? Is it, going to get bigger? Is it going to change? And it'll help them in performing surgery as well. So if you have any other questions about nuclear medicine, here's some of the sites that you can go to and visit. I will end that there. I told you this one would be short, quick 15 minutes.